Hi, my name is Dr. Cozy. It's really nice to meet you. And I see we have you here as a new patient. Okay. So you're having some sore throat, some facial pressure, some shortness of breath. Okay. All right. So, how long have the sore throat and facial pressure been occurring? Do you know about when this started? Okay. Have you taken anything for symptomatic relief? Okay. And did it help? Yeah, that's the problem with some of those first generation antihistamines, is they do make you sleepy, which makes it difficult to use them during the day. But there are some good second gen ones that we can talk about in a little bit. Are you having any congestion or runny nose? A little bit of a cough, okay. Is it productive? Any fever, chills, or night sweats? Nausea or vomiting? How about any ear pain, hearing loss, or ringing in your ears? Okay. Have you been exposed to anyone sick recently? And do you have any known seasonal allergies or allergies to things outdoors? I saw that you had put your material and medication allergies, but I mean more specifically like pollen or grasses, things like that. Okay. It's good information for us, especially this year. The pollen index has been extremely high here, and so there's a lot of people presenting with some pretty severe allergic reactions. But I want to take your temperature. Oh, somebody left a cover in here. Okay. So, this guy, he does have a protective cover, so it's nice and sanitary. It's gonna go in your ears, and I'm gonna measure each side, okay? Okay. So your temperature is actually a little bit elevated. Both sides read 100.2, which does indicate to me that this is likely infectious in nature. So, I'm going to take a peek in your ears, okay? So, you're going to feel me pulling your ears back just a little. Do you see a bit of redness inside of the ear? But there's also a lot of cerumen or earwax, which is making it a little bit difficult to see if there's any kind of fluid. Feel me pulling this side back now. Yeah, okay. This side is similar. We're gonna need to do a little bit of a clean so that way I'm able to see your tympanic membranes and rule out the presence of any fluid inside of the ears. I'm gonna put on a new one so I can take a peek inside of your nostrils, okay? So. Alright. Swap these back out just in case we need it again. I am seeing a bit of drainage. And that may be coming from your ears, it might be coming from your sinuses. We'll have to keep examining to determine that. So, okay. Take this off right now. Just want to take a quick peek at your eyes, okay? So, do your best to keep them open. I know the light's a bit bright. Can I have you look up for me? Thank you. Sorry, this exam room is right over the ambulance bay, so we get some engine sounds in here. Hopefully it's not too disturbing for you. I can just have you close your eyes for just a moment. Thank you. All right, you can open. Now I just want to take a look inside of your mouth, okay? So if I can have you open up for me. Perfect. This is just going to press down on your tongue like so. Yeah, I am seeing some redness in your throat and some active postnasal drip. Okay. Take this off. I'd just like you to keep your mouth open for just another moment. Actually, just a second, I'm going to grab a tongue depressor. Open again. Thank you. And on the other side. Okay. Not seeing any. Oh. Give me just a second. Sometimes this thing likes to pop off, which of course now it doesn't want to go back on. Come on, stinker. There we go. Ay, ay, ay. Okay. Well, not seeing any kind of lesions or anything inside of the mouth that would concern me. Some redness and drainage in the throat, but no tonsillar swelling, no evidence of any kind of pustules or anything that might indicate strep, but we will be doing a culture just to completely rule that out. Okay? Okay. So now I want to do a bit of an external exam, alright? So I'm going to be looking at your ears, your sinuses, as well as feeling down your neck and shoulders, looking for anything we call lymph nodes, which could help and indicate an infection and also where that might be occurring. So, going to start with your ears. And let me know if anywhere is tender. And don't be polite because it's helpful. Not seeing any kind of external involvement. Check your parotid glands. Stage and tubes. Not feeling any inflammation there. pressure. Okay. How about here? Yeah. Have you been feeling like you've been having any kind of tooth pain occurring? Okay, yeah, that tracks. If I can have you close your eyes for just a moment, I'd like to feel for any kind of infraorbital lymph nodes present. Thank you. You can open. Yeah, your frontal sinuses are definitely inflamed. Adenoid and sphenoid as well. We do have some submandibular and cervical lymph nodes present here. Okay. So I'd just like to listen to your chest just to rule out any kind of lung involvement. Okay. Can I have you take a deep breath in and out for me? Good. And again. 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 Okay. And I'm gonna reach behind your back. So, another deep breath for me. Okay. And same thing this side. All right. Lungs sound clear. I'm not hearing any kind of wheezing, rhonchi, rales, anything that would concern me. Married. Okay. So I do want to collect 2 cultures. And just a moment. That was my last culture. I'll be right back. These ones are doubles, so they will be better suited to our needs anyway. And we lost one, but that's fine. Okay. So this is a nasal speculum, and it looks intimidating, but I promise you it's not going to hurt. It just helps me see where I'm going so I don't hit any hot spots that might irritate your sinuses further. So I'm going to just slide right inside your nostril like so. See, not bad. And other nostril. Okay. I'm gonna bring my light back for this next one. So this one can be a little bit unpleasant, but I'm going to do my best to make it go as quickly as possible. So if I can just have you open for me. Great, okay. I know, sorry. I'm going to break that up a little more. There we go. Okay. So I'm going to have those processed for culture and sensitivities, because oftentimes with sinus infections, they can be bacterial in nature. So if that is the case, and we need to prescribe you any kind of antibiotics, I want to make sure that we prescribe you the correct one, so that way we don't worry about any kind of development of antibiotic resistance, because that can get very difficult. Anyway, I do need to give your ears just a very quick clean so I can get a better visual of what's going on inside them, okay? Okay. I promise you it's not going to be super invasive. It didn't appear like your ears are impacted, just that there's enough cerumen in the way, or earwax, that I'm just not able to see what's going on in there, and I can't rule out an ear infection if I can't see. So let me know if any of this is comfortable. Is that okay? How's that side? Is that okay? Okay. Don't want to hurt you, so. Okay. I think that should be enough. And take another look inside of your ears. Okay. So I am able to visualize your eardrums now. And they don't appear to be, or this one at least, doesn't appear to be inflamed. I'm not seeing any drainage. But the interior of the ear canal is pretty inflamed. So there's the potential presence of an infection, just not able to see it. To the other side. Okay. Yeah, I'm seeing the same thing on this side. There's no fluid present that I can visualize, but there is that same irritated red skin in the ear canal here. Okay. So I can't definitively rule out the presence of an ear infection, but I suspect there may be one occurring just deeper inside the ear. And I'm not able to get any fluid for culture, but that being said, when the ears do have fluid and it drains, it does go down the throat, which we did culture, so there is a possibility that we will be able to catch that there. Okay. Okay. Likely if there is a sinus infection and an ear infection, it's the same process, so we should be able to get answers from the samples that we did obtain. So hopefully that's the case, and if not, we will do some further investigation. But I don't want to poke you and prod you too much right now because I can see that you're already pretty uncomfortable. So I think it would be great right now if we provided you with some symptomatic relief. So I'm going to give you this box of Kleenex. I'm going to set it right here, so if you need a tissue, please grab one. And I'm going to see if we can't provide you some relief here in office. Just using some of these hot packs, it can help and dilate the vessels and allow more drainage to move through to be more productive and help relieve some of that pressure. So I just need to activate these. Okay. There's one. I do have these wrapped in some towels to prevent them from being too hot, But if you would like me to add an additional towel, I can do that as well, okay? Okay. So, just for a quick temperature check. How's that? Okay, good. So I'm just gonna hold these here for just a few minutes, okay? And also, I should say, if these do start becoming uncomfortable or too warm, let me know. Sometimes for people that heat can build up. I'm gonna put these over here for you, okay? So if you need them to use again, please feel free. Do you need tissue? Okay. Let me know if that changes. Alright, so I do want to prescribe you some medication. But we will be waiting to add an antibiotic until we have culture results back. Because also, if it turns out that this is viral in nature, then any antibiotics we prescribe, they're not going to do anything for you. And we very much do not want patients taking antibiotics if they don't need them, because again, that can lead to antibiotic resistance. And that is best avoided. So just a sec, I need to check your allergies and your medications. Okay. And then that should be a problem. Alright. So I am going to be prescribing you Flonase as well as some Zyrtec. And both of those things you can get over the counter. However, if I prescribe them, then your insurance should pay at least a portion and it should save you some money, because those medications can get pretty expensive. So And I see that you have CVS on Main Street listed as your pharmacy. That's correct. Okay. So we will get that called in. Alright. So for the Flonase, I want you to do 2 puffs twice a day. And when you put the tip in your nose, I want you to angle it outwards, not straight in, so that way it gets to your sinuses more efficiently. Okay. And then for the Zyrtec, 1 tablet at night before sleep. You can take it in the morning if you prefer, however, it can cause some drowsiness, so a lot of people prefer it at night. And then saline irrigation in between the Flonase use can help. If you have a neti pot, that can be great as well. Just make sure that you used distilled water, not tap, even if it's filtered. Distilled, because we don't want to risk introducing any kind of bacteria, which can happen. And then you can use over-the-counter symptomatic relief, such as Benadryl. However, I would encourage you to wait until we get culture results back and try to avoid that if possible, just because Benadryl can make you pretty sleepy and can have some other not ideal side effects, and that on top of the Zyrtec can really make functioning difficult. So up to you, but I would encourage you to try to avoid it if possible. And then lastly, using a warm compress on your sinuses, anti-inflammatory such as ibuprofen or naproxen can also be really helpful as well. Just make sure you take those anti-inflammatories with food, okay? Okay. And then these culture results, we generally have a response, or at least a preliminary, back from the lab within 24 to 48 hours. I will call you within 48 hours anyways, just to check in and see how you're doing, and that way you know that it didn't get lost in the shuffle, okay? Okay. Do you have any questions for me? Okay. Well, if that changes, feel free to give me a call. Otherwise, I will be in contact with you in the next couple of days to discuss antibiotic use, culture results, and next steps, like if I feel like we should have you come back for a follow-up, okay? Okay. And please do not hesitate to call if you have any questions or any kind of worsening symptoms, all right? Okay. It was really nice to meet you, and we'll talk soon.